Welcome back, everyone. I hope you've managed to refresh yourselves and you're feeling energized for the second round of pitching today at CHI Healthcare InnoMatch 2024.
Well, for those of us who've joined online as well as live here in the hall, we've got our esteemed panel of 7 judges from MOH, Temasek, AIC, Synapse, and all our 3 public healthcare clusters here to select up to 3 winners today, and they'll each receive up to 500,000 Sing dollars to test bed their solutions in Singapore.
Yes, exciting. So we've heard 4 wonderful pitches. I must say I'm very impressed.
Really good start.
How will the next 4 compare?
So let's jump in and meet finalist number 5. They are from Singapore. So their company is called Rosesso, and Rosesso Technologies will be presenting their solution, Signi Connect, which aims to enable remote prescription of medication and therapy at the community and at home. So let's look at their video pitch.
Hello everyone, I'm Jen. I'm the co-founder and CEO of Rosesso Technologies, a Singapore-based medical device company specializing in neuro rehabilitation technologies. Our vision is to enhance the quality of life through neuro rehabilitation anytime and anywhere. The patients we are trying to support are patients suffer from neurological disorders such as stroke, traumatic brain injuries. Globally, 3 billion people suffer from neurological disorders and 2 billion need rehabilitation. In Singapore alone, we have more than 10,000 new stroke patients every single year. And there are so many struggles. For example, there is a shortage of rehabilitation professionals. In Singapore, we only have 1,200 active occupational therapists, and the ratio to patient is only 1 to 10, compared to some other developed countries, for example, Germany, 1 to 2. There's also a lack of portable and effective rehabilitation devices, especially for upper extremity, such as hand. Also, there's a low treatment intensity with traditional therapy. That's why we created ISO Glove, which is a soft robotic hand rehabilitation system, offering continuous passive motion and intention-driven active training with our sensors such as EMG sensor and hand tracking sensor. The system is very easy to wear, very fast to set up. You only need less than 3 minutes. It's also extremely portable. It can be used in any environment, such as home. It's very comfortable with the soft material that we use and very lightweight. Recently, we also developed cloud-based remote therapy system and also assessment and gamification function. It can be used isolated from the hospital system. That's why it's very easy to implement. For patients, we are able to achieve more than 90% improvement on treatment outcome. The data was derived from the ongoing clinical trial with Jurong Community Hospital and Alexandra Hospital. For therapies, we are able to reduce more than 25% of repetitive work. For hospitals and clinics, we are able to reduce manpower costs and increase revenue. ISO Glove has been approved globally in more than 50 countries, including Singapore. Also, we have passed numerous tests, including safety tests and performance tests for rehab robots, including home environment. For the past many years, we have been renting to home to treat patients with high intensity. So here you can see this is one of the patients we have treated. After 4 months of treatment, we can see significant improvement. We do have competitions. Compared to our competitor, we are able to offer much more number of exercises, more portability, lightweight, and higher range of motion, a shorter set of time, and more comfort. We have sales partners in more than 20 countries and numerous partners and customers in Singapore. Traditionally, we were mainly implementing B2B model, which means we sell to distributors, distributors sell to customers. Through CHISEL, we are hoping to achieve a more scalable and sustainable model, which is a B2B2C model. That means we rent to our partners, hospitals, and service providers, and hospital service providers are able to deploy the system to home or community. So we are hoping to achieve the goal, which is insurance coverage for majority of the patients and government subsidy for low-income household. So after Singapore, we are hoping to scale globally, including US, so especially with the newly released reimbursement code. So after CHISEL, we are hoping to implement an AI-driven system for different parts of the body with modular robotic parts, such as for wrist, for elbow, for wrist, for ankle, and other body parts as well. Thank you so much for your time. We are Rosesso Technologies.
Thank you. And let's welcome on stage the CEO of Rosesso, and that's Ms. Jane Wang.
Hello, testing.
Hello. Okay, and over to the judges now. Let's see. Chi Seong, any questions for Jane?
Hey, hi, Jane.
Hi.
Yeah, I had a chance to also hear from experience of some of the clinicians that are involved in the trial.
Yeah, thank you.
Yeah, so far the feedback has also been fairly positive. Just want to find out in terms of also the opportunities and some of the ability to customize in terms of the different sizes and the different potential anatomical defect or some of the different features of the hand. Would this device be able to accommodate this?
Okay, so far we have been, I don't think there's a high need for customization because we are using soft robotic technology. So for now we have 3 sizes, S size, M size, and L size. Most of the patients in Singapore are able to use S size and M size. In Europe and US, people are using L size mainly. But we do have people who are requesting for pediatric size. So we are now looking at, developing gloves for children. Cerebral palsy patients as well. So right now, I think the main customization is mainly on the thumb because there are more degrees of freedom for the thumb movement. So we are now looking at it maybe to develop certain accessories to change the thumb orientation for our robot for different kind of patients. Yeah.
So I think in the video you highlighted.
Yeah, thank you.
In the video you highlighted in terms of the soft materials and all, but I'm just wondering, right, especially in the possibility of deployment in home. So far, what's the use case in terms of the number of patients that have been trialed at home, and what's the overall experience, especially if there's any negative outcome so far? Just want to find out.
Yeah, so far since COVID started, I think we have tested more than almost 80 patients. So they all contacted us initially all directly, and later on we do have doctors who refer patients to us, also therapists. So far we don't really see much challenges, so they can just easily use the device. They can learn very easily. We do the installation for them, then we train the whole family, including the caregivers and maid. So even the elderly, they can use it very easily because since the beginning we designed the device for the community and home. So even though the initial business model is B2B, so far no discomfort reported, no injury. There was only one case where the patients didn't follow our instruction. And she's very young, she's extremely eager to recover, so she's over-exercising herself. She's exercising with our devices 3 hours per day, which is too much. So eventually we told her, you have to stop. So we stopped the exercise. That's why later on we integrated with a lot of sensors to monitor, right? To derive the data and to monitor if any of the patients are over-exercising. Yeah.
Great.
Thanks.
Happy problem. Okay, next back to you, Edwin. You have any questions for Jane? Yeah.
Hi, morning, James. Thanks for the presentation. I have 2 questions. Do you store the data locally on the machine or on the cloud?
Okay, we have, yes. Oh, sorry. Yes, so maybe I just answer this question first. So we have 2 versions. So the first version of the software is store the data locally. And later on, we decided to deploy another platform, which is a Sydney Connect platform, which basically upload the data to the cloud. And then the therapists actually can monitor the patients remotely. So right now, we are using Amazon AWS to store the data. Yeah.
In your presentation, you did talk about the AI. Could you please elaborate about your AI plan in the future, and when would that be available?
Yeah, actually, we are already developing it with all the sensors, right? Right now, we are able to assess different kind of measurements. For example, the gripping strength, the opening strength of the patient, the range of motion for every single joint for the fingers, and also the wrist, and also forearm movement. Also, we can basically do measurement on the muscle signals of the flexor muscle, extensor muscle of the hand. So through all this data, we are able to create automated treatment plan. But of course, we are not going to replace the therapists. So the therapists are able to get recommendation from the AI system and then approve the treatment plan, and then the patients are able to access the treatment plan remotely. So beside the hand, right, we also integrated we don't only just have exoglove, we have many other devices. So one device is only for assessment, gamification, and the other device is actually we have other device for different parts of the body. So later on, the future plan is through all the sensors, we do range of motion assessment and other assessment. So automated treatment plan will be deployed, and the therapies are able to prescribe, or doctor will be able to prescribe for different parts of the body, depends on the patient's need. Yeah.
I'm good, thanks.
Okay, thank you, Edwin. We've still got a bit of time. Any other questions from any of the other judges for Jane and Rosesso? No, if not, thank you very much, Jane. Thank you.
Thank you.
All right.
Thank you.
And who's next, Tamsin?
Well, we've started with a bang. Let's carry on and find out who the next finalists are. The next group will also be from Singapore. We have SG Diagnostics, who are proposing a health management system designed to enhance chronic disease management, particularly for high-risk elderly individuals who may not regularly access healthcare services. So let's take a look at their video now.
Hello, this is Kate. I'm the founder and CEO of SG Diagnostics. At SG Diagnostics, we provide affordable and accessible diagnostic solutions to improve people's life. Today, I present to you point-of-care test solutions for community health management. As we all know that the world is aging, including Singapore. Aging brings additional challenges for elderly patients because multiple trips are required for simple chronic disease follow-up, long waiting time, and other additional discomfort. Even though Singapore government have launched effective schemes on chronic disease management, including War on Diabetes and Healthy SG, there is still a substantial group of people avoid basic health screenings. They shy away on community outreach programs. Fundamentally, it's because they have minimum to no understanding of chronic disease complications. So we believe there are still 30 to 40% of the communities are yet to be reached. As we often say, if the mountain won't go to Muhammad, then Muhammad must come to the mountain. Here we come with our solution, Precise Health Management System, with our fingerprint, easy-to-use HbA1c analyzer and chronic analyzer. Our whole suite of chronic disease solution management is aimed to reach the hard-to-reach population through door-to-door screenings and education. We are different because we're the only one can provide lab-level accuracy, which is already used in multiple clinics, and our results are within minutes, all finger-prick with portable devices and room temperature storage. At the same time, we partner with our healthcare partner on the data management system. So we have an in-house built data management application module where all the data are collected together with the patient identifications. Then we work with our close partner, National Healthcare Group, to take care of the medium to high risk population. Together, we aim to reduce the national healthcare expenses by better education and early screenings. Our objective in CHISEL is to scale up of our solutions that are already tested in the market. We aim to partner with Silver Generation Office, All People's Association, to test those age 40 and above for chronic conditions. At the same time, we'll educate the public about diabetes complications and chronic disease complications. We target to reach the hard-to-reach population by door-to-door screening and education of 10,000 individuals in 8 months. We enable a razor blade business model where the analyzer comes at a low profit margin and will generate more profit from the repeat use of the test strips. And this model has been demonstrated in B2G, including our SingHealth PCN customer, National Healthcare Group customer, and B2B, like our Raffles Medical Group customers and other private healthcare providers, as well as B2C. Our solutions are already available on online channels and various pharmacy channels. We are special not only because we're easy to use, we are accessible, also because we are cheaper, way half the price of our competitor price. And at the same time, we have a bigger target in mind. With our wholesome solution, we target to save the government healthcare expenses by preventing the diabetes complications into the morbidity complications. In future, in less than 10 years, we aim to save government hundreds of millions of dollars in preventing those morbidity education by screening and early education. This is a list of our existing customers, including the government customers, healthcare, private healthcare, consumer, and as well as corporate. So SG Diagnostics is a homegrown company. We were founded in 2020, and in less than 4 years, we have achieved 20% of the market share for HbA1c rapid test. So we are a global company from Singapore with a vision of accessible and accurate diagnostics to anyone, anytime, and anywhere to improve people's life through quality point of care diagnostics. So together, we aim to provide a better aging society. Thank you.
There we have it. Thank you. Let's please welcome Kate Chi, Chief Executive Officer, and Jian Hao Bai, Chief Operating Officer of SG Diagnostics here. Thank you on stage. Right.
Welcome.
Let's hear what the judges think. Perhaps we can start with Colin. Thank you.
Hi, Kate. Hi, Tian Hao. Congratulations on being a finalist. Just wanted to share the problem statement you're trying to address is very much an issue that the Ministry of Health is concerned about. And I can happy to share with colleagues in this room. Actually, this has been the subject of various discussions with our minister over the past 1-2 months. So definitely a core problem area. I read your report that said you did several community events with many partners in 2023. Can you share some of the difficulties you encountered and what were the lessons learned?
Okay, thank you, Colin. So in the last year, we have done more than 20 community events. In total, we screened more than 2,500 individuals. So the challenges we face, number one, there's always the same group of people coming to the community events. For example, we did 2 events in Sengkang East, and the local PA people told us they always see the same faces. So the community events is not effective for the hard-to-reach population. Those don't even go to the community outreach. And the second challenge we face is out of the 2,500 plus data, we didn't manage to keep any of them. So we don't have any follow-ups. If in a community event, we have a HbA1c of 9, 10, we don't know who they are. So those are a pity, and it's one gap we wish to fill with this CHISEL applications.
So given you've identified those challenges of the untouched, how do you see yourself going out to find out about these people? And as you say, after you get a negative result, how do you want to follow through then?
Hi, right, so as a grassroots leader, so when we do house visits, right, if we actually get 50% hit rate, that's actually very good for us. So we actually, when we try to, we have other ideas like how to improve interactions with the residents. So we will do block parties below, then we'll get them come down. So then during this interaction, we can do education, let them know what's happening, and then do the testing. And by doing so, we actually catch the low-hanging fruit people who are like open to do all this. And with this, we can segregate, okay, these are the easy to catch one, and then those which do not come down are the ones that we have to do the door-to-door follow-up.
I want to add on top is for the follow-up, like last year, all the healthcare screenings, we are partnered with healthcare partners like Raffles, Crawford Hospital, etc., so that they can also get the Healthier SG sign-ups. So after they sign up, the healthcare partners can follow up with those individuals.
Great, thank you.
Thank you. The age-old challenge of activating communities. Shu Qing, any other questions?
Yes. Well, thanks, Kate and Jian Hao. This is I'm very impressed by your pitch, because this is the first time I'm hearing a vendor, if I could call you that, really having such a national view and an approach towards things, because you mentioned that you've owned the problem of having the same people coming for the community events and not having any follow-up after screening. I'm curious, what's that got to do with you as the vendor?
We see ourselves as more of the solution provider. Okay, what we can do before, like community outreach is not new. There has been community outreach with glucometers, with BPs and other things. And what we could do with our devices is we were the first one could do with HbA1c, since it no need fasting, it's also more accurate way to monitor. And 6 minutes test, we also noticed that all the 6 minutes is perfect window for educations. So through our past screening event, we actually get more equipped and more aware of the problem. That, it's just natural. When we do more community event, your heart is more close to those individuals. You really want to help. Actually, my team here, like Hui Yi and Jesslyn, they have been to so many community events. So we really want to scale it up to make it more proper, to reach those really hard to reach populations through those initiatives.
Oh, wonderful. Okay, so you mentioned that your solution is to work with PA and SGO to do door-to-door screening, right? Again, have you approached them?
So I have approached a few PAs, and through our last year events, we have worked with a few PAs, including Sengkang East, including Woodgrove. So they have indicated interest. We have kind of worked out with the flow and everything. Yeah, so we're working quite closely with them.
Okay, because then you will be required, basically that means it has to be easy enough for volunteers to learn to use it, right? So that actually my question was, how easy is it to learn?
Okay, so all our devices are approved for lay users. So all the community events in the past are not done by nurses or trained personnel. We have part-timers, students, part-timers. We have in-house training and education program that we just train them, then they can just be easily deployed.
Last question. That's great. So we say screening without intervention is of no use. So PA, great. You screen, you find a problem. And what's your plan for intervention?
Okay, so that's why we are here in CHISEL. So we need the healthcare partners' help with the interventions. The best we can do is really send the hard-to-reach population to your way.
True
More work
partnership
shooting.
approach.
More work shooting.
Okay, I look forward to hearing some of your plans too. Okay, thanks.
Thank you. Any other last question from the panel here? We're good to go. If not, thank you so much, Kate and Jianbao.
Thank you. All right.
Okay, we are down to the last pitches, 2 more to go.
Okay, finalist number 7 is Tekel Medical, also known as Medictor in Spain. And they'll be introducing us to their solution, the empathy-driven AI healthcare assistant. So their video pitch is going to tell us about how this can assist patients by guiding them through a series of questions to generate personalized recommendations and even some diagnoses as well. All right, let's watch that video.
New platform created by Medictor after Sensory acquisition. Medictor simplifies the patient management with an all-in-one platform. We are now the empathy-driven AI healthcare assistant. We know nowadays worldwide we are facing a global crisis, which is shortage of healthcare professionals and saturated systems, especially emergency departments. We are now providing a virtual assistant for all kind of healthcare concerns. With this engaging solution, we can provide you saving time and optimizing resources solution. As you may know, we do have 2 products. One is Medictor for patients, and one is Medictor Plus for professionals. You can shape your platform according to your needs. It works exactly is a medical chatbot with the general physician. So you state your symptoms using your own words, and using natural language processing technology, our AI tool will detect the main symptoms and start asking questions exactly like a general physician would do. We provide a final screen with a list of possible conditions and recommendation on what to do next. So the final screen represents the level of urgency and the recommended action, which are your business services. We can integrate your services according to a medical recommendation schema. The most powerful part and our added value in the market is our natural language processing technology. Not only because we provide this in 18 languages, but also because we have the highest adoption rate, because of our very straightforward and seamless experience. Users and patients can state your symptoms multiple all at once using their own words, not regarding the level of literacy and typos. We provide a solution for different kind of industries. We focus on health insurance companies, hospitals and health systems, pharmaceutical industry, and telemedicine platforms. As you can see, thanks to our high adoption rate and our scalable business-to-business software as a service, we provide the service to the top 15 insurance companies, and we have integrated with more than 10 health systems. The business impact that we can provide to you, especially for health insurance companies, is cut costs and reducing the medical visits, driving all these patients and users to into telemedicine consultations, or just solving the concerns using Meditor. We cover more than 50 million people around the world in 35 countries, and we provide also very high net promoter scores for hospitals and health systems. We provide in only 3-minute AI triage, reducing the burden of emergency room department, reducing also the less urgent visits. In emergency department, we can provide different use cases. The emergency triage, where we try to ease the burden of the emergency department. So doctors use Medictors to save time with the diagnostic part and the treatment protocols. This is only possible because we can integrate into the electronic hospital records, and also we provide a very specific high resolution unit use case where nurse can provide the preliminary diagnosis and can provide a resolution of these cases managed by themselves. Medictor is created by doctors, so it's a technology you can trust. We build our own medical database, which is supervised continuously.
This is our first online competitor, and we're going to bridge the miles and connect with Veronica Mancasola, who's the global business developer from Medictor. She's calling in from Spain. Fouquet, questions for Veronica, please.
Yeah, Veronica, thank you for waking up so early to entertain us with your presentation. It is not very, one of the things that is not clear from your presentation is how competitive is your chatbot compared to some of those already in the market, like maybe Babylon Health and so on. Can you elaborate a bit on that?
Yes, thank you so much. That's a great question. Well, you mentioned one of the recently, well, more than a year ago, closed company actually. We do have a very clear vision at Medictor. We are obsessed with the user experience. In fact, we do drive the medical chatbot in a best way so that it's a straightforward and seamless experience. So we are obsessed actually with the natural language processing. And regarding your question about other competitors, we are the only one having validated clinically our solution with clinical trials made with real patients in real scenarios and random patients, meaning that our accuracy and also the adoption rate is meant to be for a real emergency department or any other hospital environment. Additionally, with the recently Sensely acquisition, we are now the only all-in-one platform providing also virtual assistant, meaning avatars that can be personalized.
Thank you. The next question I would like to ask is, how much do you think your system will cost for an average size hospital?
That's a great question, honestly. We usually do provide a specific pricing according to the use case. In a route like pricing scenario, let's say we do charge for a license fee, which include the setup fee, the medical recommendation schema, let's say customization, plus depending on the languages and all the adds-on, such as the avatars and other data and analytics part. But should be around like 200,000 per year, including the monthly fee and the annual license fee. This is, let's say, this is an average, and it could be a start for hospitals that provide, let's say, 100,000 inpatients, walk-in inpatients in an emergency department. This could be also customized, and I would see case by case depending on the number of users and also the number of customizations.
One more clarification. You're already doing so well commercially, and you have got so much traction and revenue in the commercial world. May I know why are you still participating in this healthcare InnoMatch? in Singapore?
Yes, great question. We are very interested in the Southeast Asian region, and we are already present in some of the countries around you, such as South Korea and Japan. So the goal finally is to commercialize and, of course, develop a better natural language processing understanding for languages such as traditional and simplified Chinese, which is already available on our solution, and of course improve what is the machine learning techniques that are learning from each interaction. So we for sure understand more about the localized user experience, and also from the medical perspective, we do of course provide tropical diseases, and we've done clinical trials for tropical diseases, but we'd be of course more empowering our solution having implementation in a country such as Singapore.
Thank you. That's all from me.
Thank you, Fouquet. Su Ying, over to you, please. Yeah.
Hi, Veronica. Thanks so much for sharing your very, very nice solution. Just two questions from me so that you can take them both together. The first is, I think your model is trained based on the sort of knowledge base that you have, your medical data. I was wondering what was your plan to train your model based on the Singapore knowledge base? Do you require us to bring our data to you? Are you prepared to base your model here in Singapore? That's the first question. And then the second question, I think you mentioned that the solution is integrated with the EHR systems. In Singapore, we use Epic. Can I get a sense from the readiness of that integration with Epic? Thank you very much.
Amazing. Thank you so much for your question. I would invite the team to share maybe the back slide, Annex 2, mentioning all the electronic hospital record that we can integrate into. We have done Epic. Yes, the second one we have done with Epic, and okay, yes, the second. So we have done it. We have done it in multiple hospitals, such as in Spain, in two public university hospitals, and if I'm not wrong, also one more in the USA. So consider that right now, Medictor acquiring Sensely as also as a back-end dictionary and content, the Mayo Clinic contact. Mayo Clinic, as a prestigious, renowned worldwide organization, is part of our board and is actually reviewing our medical database. The medical database was built since 2011. It's part of our core, and of course, when we have to train it for new users, we do use different methodologies, such as the auto test, manual test, and vignettes. So in case of, as you mentioned, in case of an integration in Singapore, of course, we are ready and open to train it using, let's say, the manual train or auto train coming from the contextualization. But the medical database can be reviewed every 2-3 weeks, where we can add different synonyms, especially for the linguistics part. We're very open to training and updating it. We usually do that every 2-3 weeks. It's also depend on the group of diseases. If you are thinking about some specific diseases, we've done this for tropical diseases, so it's very easy for us to replicate the same, let's say, training.
Thank you, Veronica. We've got one more question from Colin. Yeah.
Yep. Hi, Veronica. Colin here. Can I follow up on the point that you made about the importance of training? So typically, since you brought this solution to many countries, how many hours or data sets do you need in order for you to feel confident the results you will get in Singapore would be comparable to the US or Spain?
Yes, great question. Actually, we did that with IHH Healthcare Systems more than 1 year ago for Singapore. Usually, it is part of the initial integration and a test part, and it takes from 1 to 2 months, meaning that we drive some auto tests, some manual tests, and we start usually with a specific environment with specific users, and then to extend to multiple. It also depends on the language that we want to test. Honestly, for Japan was a bit more. It was for 2-3 months, specifically because we at that time we didn't have any user using the Japanese language. So let me say 2-3 months to be very very sure and wise on this decision.
Okay, thank you very much. Colin, you okay? Thank you. Okay, Veronica, muchas gracias. Lo siento for all the technical glitches just now. We'll see you in a short while. Everyone, Veronica from Medictor.
Thank you. It's always interesting when we're leaving the judges hanging. Xu Ying was dying to ask something else, but it's okay. We have to be fair. We are down to the last presentation. We're going to hear now from ViewMind, all the way from the US, on their platform that offers highly accurate, non-invasive cognitive assessments by detecting fine-grained changes in cognition through the eye. So let's take a look at their video pitch.
Hi, my name is Matthias Schulz, and I'm the Chief of Product and co-founder at ViewMind. Singapore faces a growing challenge as it transitions into a super-aged society. By 2030, 1 in 4 citizens will be aged 65 and above, significantly increasing the prevalence of neurodegenerative diseases like Alzheimer's. Traditional diagnostic methods are expensive and often rely on the time and expertise of professionals, which can lead to inaccuracies and delays in diagnosis, translating to higher healthcare costs. Singapore needs an accessible, accurate solution to address this rising burden effectively. Using a VR headset that tracks eye movements during visual exercises, ViewMind detects cognitive impairment at early stages, allowing timely intervention and personalized care. Our machine learning algorithms, which are based on 25 years of scientific research and multiple patents, provide objective assessments. Our technology is designed to be accessible across diverse populations, helping Singapore reduce the long-term costs associated with aging and cognitive decline. ViewMind is unique for its level of accuracy. For example, in this plot of patients who were diagnosed with cognitive impairment, the Mini-Mental misdiagnosed more than half of them as healthy. ViewMind, however, detected cognitive impairment in most of these patients. ViewMind can detect and describe cognitive impairment as good as 2 or 3 hours long evaluations, but in just 20 minutes. In this ViewMind task, the patient must look in the direction of the arrow if it's green, and in the opposite if it's red. The 2 dots are where the eyes are looking at. Our precision comes from tracking eye movements every 100th of a second, analyzing not only the right and wrong answers, but the decision-making process. This can't be done in a tablet-based platform, where you only see the answers and not the reason behind them. We are already piloting with the National Neuroscience Institute of Singapore in Cognition, which could set the basis for the test bed protocol. As dementia progresses, so does the cost of living, but early interventions can help delay the onset of dementia for years. In fact, delaying the onset of Alzheimer's by 5 years could reduce its prevalence by almost 50%. For clinicians, ViewMind reduces the cognitive tests from 2 hours to 20 minutes, being precise and easy to use. For providers, it means cost-effective assessments and early interventions. ViewMind is compatible with multiple off-the-shelf hardware, working with trusted partners to ensure production and worldwide logistics. We don't touch the hardware. We focus on the service. From agreement to deployment, it can take as little as 1 to 4 weeks. Our platform requires minimal online training and is designed for easy integration into existing healthcare workflows, including electronic health record systems. As shown, we comply with multiple regulations and quality standards. Our white box algorithm is based on medical knowledge and uses a global dataset, including Singapore's population. Once trained, we freeze the algorithms to ensure no risk of artificial intelligence continuous learning. Our subscription-based model includes a per-assessment fee and an annual subscription for longitudinal monitoring. With this study, we aim for approval as an adjunctive tool to diagnose mild cognitive impairment, which will be the basis of our commercial strategy with specialized centers. Afterwards, we will pursue additional approvals for differential diagnosis aid in diseases like Alzheimer's and depression. The second phase of our commercial strategy is to expand to public health systems for scale, lower costs, a broader access, setting Singapore as our center of operations for the Asia-Pacific Center. Thank you very much for your time.
Thank you very much, ViewMind and Matthias. So we are going online again. I think hopefully Matthias Schulz, the Chief Product Officer for ViewMind, is joining us online. Matthias, you're there. Can you hear us?
I can hear you perfectly well.
And we can hear you. Wonderful, wonderful, wonderful. Okay. Little joys, little joys. Okay, we are going to start with Chen Ern. Questions with you, please.
Okay. Yes, thanks very much for joining us all the way from the US and a very interesting product. Just a few questions. First is, while the tool may be useful, how do you envisage getting the people to use the tool? That means who will be operating it, and how do you bring the people down, or do you need to work with someone for that? Yeah, thanks.
That's a great question. So initially, what we do is we focus on clinicians. We focus on specialists, right? Neurology, psychiatrists, to use this kind of evaluation. But the vision of ViewMind is to be in the first lines of defenses, like, for example, nurses. When we develop a market, we go from specialists into the primary settings of care. For example, in Latin America, ViewMind even goes into the community centers where people play bingo, they dance, they socialize, and ViewMind can be installed in those particular places in order to identify impairment in the early stages and triage into the clinical setting. But initially, as I want to say, we need to focus on things that are already working in the health system in Singapore. So we will start with the clinics and specialists.
Okay. And what kind of minimal hardware is needed for this to work?
That's a good question. Just two things, only a tablet and a VR headset with eye tracking. We provide both devices. So what we do is we don't touch hardware. We have a partner, an OEM who manufactures everything. We ask them to install and ship it to Singapore. Additionally, we don't make money on hardware. We give you the hardware at cost, and it's going to be less, around, let's say, $5,000 to $10,000. And then what we do is we charge a per evaluation fee, as said.
Okay, yeah, so that's my next question. That because when we use it for screening and on the per use, it can come out to quite a bit of a cost. So what kind of subscription fee are you thinking of?
That's a good question as well. We are still defining our pricing strategy within Singapore. Just for you to know, we can work a pricing in the United States and Europe, and we can also work a pricing in Argentina or Brazil or countries who are not well economically. Our initial vision was to locate our price around 150 Singaporean dollars. But then again, we still need to define it. It has to be way less than a traditional cognitive assessment evaluation, and that's the value that we're going to be bringing. But the additional thing is that we want to work with the public healthcare system. And as we gain volume, the pricing will be reduced drastically. Our goal is to have volume, to be able to send as many people into the healthcare system if needed. So as we get more people, the price will be reduced drastically.
Yeah. Yep. Hi, Matthias. Colin here. Thanks for the exciting presentation. On a personal note, my 80-plus-year-old mother is suffering from early dementia, so I can relate to what you're proposing. I've got two questions. First question is, you did some pilot work with the National Neuroscience Institute. Could you share what were some of the lessons you got from that? And then second, assuming you are successful and you're shortlisted to work here in Singapore, can I get a sense of the commitment and investment your company will thereafter make in Singapore? Thanks.
I couldn't hear well the second question, so I'll ask you to repeat it, but I'll start by answering the first question. So by working with the NNI, we learned many things as we do whenever we do a study. First off is that the product works equally well in Singapore as it does in the rest of the world, and that's something that we wanted to check. We know that ViewMind is culturally agnostic, and what I mean by that is our visual exercises do not harbor any kind of cultural background. We don't show animals, we don't show words. We only show things which are abstract. And we have validated this among different countries if the results we get in one place are the same results that we get in another place. And it was a good thing to see that in Singapore, we get the same results as well as we do in Malaysia, where we have also validated the device. The second thing was to understand that we are also ready regarding the cybersecurity status of the company to be able to be integrated with ViewMind from both sides, from a side of compliance with cybersecurity and from a side of being able to integrate with existing API electronic health record systems.
Thanks. I'll repeat my second question to get you a sense. So great, the NNI pilot went well. Assuming the judges do pick you as one of the winners, can I get the sense what's your company's level of investment in Singapore thereafter? Will you set up a 5-10 person office in Singapore, put a very good scientist here? What are your plans?
I'm glad you're asking that question. I wouldn't be here if the only goal was to get let's say a test bedded or a grant or whichever is the meaning of what we're submitting. What we're here for is because we want Singapore to be our center of operations. I want ViewMind to be able to operate from Asia Pacific region from Singapore. And that's literally the main goal. I'm really happy to be able to test bed my product in Singapore. I believe that it's something that we will have eventually done, regardless of the grant. Hopefully, we will be able to do it with this opportunity because our reach will be much better. But Singapore has an operational strategy, let's say, meaning for ViewMind. Absolutely.
So if I paraphrase, you'll invest in a 20-person team here then.
Yes, no, absolutely. That's absolutely the goal. That's what we want to have in Singapore. Offices and people, substance.
It grew from 5-man team to 20. This is what scale is looking like.
This is what Singapore does.
This is Singapore turbo boosted.
Right.
Any last question from the panel before we wrap up? No? Matthias, thank you so much for joining us. We will see you again later. Thank you so much. That wraps up our pitches for the morning. Let's have a lovely round of applause for all of our presenters today. And also for our judges. Thank you.
Right, Tamsin and I have really been blown away by the amazing showcase of innovation, and I think we both need that last dementia app at some point in time, very soon.
Is it only me that already failed the test? Red arrow, green arrow, I've already failed.
I did too. All right, however, it doesn't matter what Tamsin and I think, but what all of you, the audience, thinks as well. So let's now take a quick look at the current poll results for the audience's favorite.
Oh, okay, looking exciting up there.
All right.
The numbers are continuously changing. I'm sure that as we say, oh, look, here we go, going down. Come on. Who else do you want to see up on the top of the leaderboard here? Do drop by the finalist booths that you'll find on this floor so you can find out a bit more. Give them a chance to let you play with the solution, influence your votes. Remember what I said at the beginning. You're allowed to vote as often as you like, so don't hold back. Show them some love, okay?
All right. And now it's time for our judges to do even more work, and this is the last bit we promised you, our judges. They'll now leave to do their deliberations. So thank you once again, judges. Can we show you out of the hall, please?
Thank you. And to the audience, we have, as we've mentioned, healthcare innovators, entrepreneurs, players in the healthcare industry. We have exciting news to share.
Right? So, if you're an entrepreneur, have you wondered how your solution could be better catered to the evolving needs of healthcare? Or for healthcare practitioners, if you're struggling to find that right company or that solution provider, like what we're trying to do down here, or perhaps you just want to gain inspiration to start your solution to scale your project. All right? So, we're proud to introduce a platform that CHI is developing called the CHI Learning and Development System, or we've called it CHILD in short. So this is a national platform. It's open access to all of you, and it's actually a knowledge management repository that's funded by MOH. It hosts all the projects that have been performed and done by public sector healthcare, for a start, related to innovation, productivity, and improvement. And we hope to empower all players from healthcare, industry, and academia to exchange and co-create your knowledge and your ideas.
Yes, so that does include you, yeah? By sharing your learnings with others, learning from other healthcare innovation projects across Singapore, or, as we've seen today, overseas, and connecting and collaborating on new ideas as a community of practice, CHILD is the starting point for your healthcare innovation journey. So stay tuned for its launch in the first quarter of next year.
So those of you who've scanned the QR code, that's going to take you to our interim website. The official website launches in the first quarter of next year, but you get a great sneak peek of what's to come. So far, we've collected about 1,500 projects from across Singapore. So if you want to search on how other people like yourselves are dealing with fall detection, with tele-rehabilitation, like some of our solution providers are today, all you have to do is get to CHILD, search fall detection, and you'll see about 18 or 15 projects that are already there, and that will give you a quick start to your innovation journey. And as an alternate search experience, we've also just built in ChatGPT for projects of your interest as well.
Yes, and it's not just that search function. CHILD also offers a matchmaking service between problem statements and market solutions. So this will really empower you and solution providers, healthcare players to come together and find the perfect match for their product.
Right, so if Tamsin and I are looking for a dementia solution provider for our own purposes, we're going to get to CHILD as well. So all of you can do the same thing. So please scan that QR code on the screen. And for our audience here, you can also head down to the CHILD booth, which is just outside as well.
Yes, so for those of you joining us online, we're now going to take a lunch break, so please do so too. The live screen will resume later at 1 o'clock. That 1 o'clock Singapore time for those dialing in from overseas. And then we're going to announce that big moment of truth and excitement, the winners of this year's Healthcare InnoMatch. So stay tuned.
All right, everybody, welcome back. We hope you enjoyed lunch, and more importantly, mixing and matching with and mingling with the people that were at lunch. Lots of inspiring and innovative people amongst us. So it's time to get back to the event, and please join us with another round of applause for our finalists.
Yes, we are going to invite them back on stage shortly, and I hope those of you online are able to tune in and listen to this as well. So perhaps I can invite one person from each of our pitching teams to join us on stage. Let's start with Megan Conroy from Capture Proof, please. Let's give her a round of applause.
Right.
Thank you. Vineet Johnson from Ira Gaines, please. Thank you. Ajit Ravindran from Lenexa Medical. Thank you. Then we have Mark Wong from OcuTrack Medical Solutions. Thank you. Next, Jane Wang from Rosesso Technologies. Thank you, Jane. And Kate Chi from SG Diagnostics. Thank you so much. Welcome on stage.
And don't forget, we've got two people joining us online as well. Veronica Mancasola from Medictor. There we have her, and Matthias from ViewMine. Hello, can you hear us? Can you hear us loud and clear, both of you? Thumbs up if everything's all right.
Yes.
That's great. Thank you. Okay.
Okay, wonderful. They can hear us. We can hear them. So, Huntim, we know this. In the startup world, a 15-second elevator pitch can make or break a business, right?
That's
right.
A
lot of pressure.
That's right.
So, today, audiences online and here, we're going to see how the teams stack up with a 15-second elevator pitch. Because just when you thought we couldn't get meaner by putting them in front of these guys, we're now making them do their last 15-second pitch. You have got one sentence each to tell the audience what makes your solution a standout one, because you are trying to influence the audience vote. Remember, guys, you can still vote again after this. So perhaps we're ready to go?
Ready to go.
Timer ready? Let's get started. Megan, take us off with your 15-second pitch.
Thank you. We all know someone who's at risk of falling. Falling leads to the largest accidental death across the globe. Give your loved ones a chance to stay at home, age with their grandchildren, and die gracefully. We ask you for your vote, and we want you to understand that this is not just about falls, it's about all of healthcare. Thank you.
Perfect timing, well done. Thank you, Vineet, over to you.
Just turn around and look. Every corner of this room, everybody's got their hands moving. There's not a single soul whose hand is just lying still. It is very, very fundamentally important to everything we do in life every single day. When someone loses it, their dignity, their independence, everything is lost. That is what iRegain stands for, to make that change. We want every patient, every clinician, every investor, every stakeholder to say, I regained. That's the name of the company.
Great.
Oh, well done, well done.
All right.
Great punchline. Please pass it along. We will ask Ajit next from Lenexa Medical. Hit us with it, Ajit.
1 million people die every year from preventable brush injuries, mainly because the standard of change hasn't changed for the last 200 years. At Lenexa, we aim to bring a proactive, personalized device that is a must-have in hospitals and is changing the care. So join us in solving this preventable problem. And of course, no pressure.
Thank you, Ajit. Wow, they're really pulling out the stops for the audience vote here. Mark, next, please.
Thank you. Occutrite provides assurance. Once upon a time, there's a group of diseases that causes blindness, and that is scary. But with our technology, we can now ensure timely intervention and maintain your precious gift of vision. Join us.
Wow, thank you very much. Okay, Jane, over to you with Rosesso.
We are Rosesso Technologies. We bring independence and dignity back to people's life. Thank you.
Oh,
Short,
but sweet.
Beautiful.
Thank you. Okay, finally, from last one on the stage, Kate. Let's hear what you have to say.
Okay. The economic burden for diabetes alone is more than $1 billion for Singapore. Still, there are 30 to 40% of the people who don't know the condition and don't know the implications. So we are SG Diagnostic. We are a local company. We aim to improve people's life and provide a more resilient aging society by providing quality point-of-care diagnostics. Thank you.
Oh, thank you very much.
Lots of energy. Great. Thank you.
Yes.
And let's move on to our online participants. Can we bring Veronica on screen? Veronica, you've got 15 seconds. Here you go.
Thank you. Think about right now in this moment, 7 a.m. in Spain, a lot of people, ton of people queuing and waiting for triage in emergency departments, while we have clinicians and medical staff burdened and saturated. We can avoid this, giving back time and reducing the waiting time for patients, and also making it more efficient for health professionals, thanks to Medicare. So thank you very much and hope to see you soon.
Thank you, Veronica. Round of applause. And last but not least, Matthias. Can we bring Matthias online? Okay, Matthias, you've got 15 seconds and off you go.
Thank you. So ViewMind is about preserving what matters most. It's our brain, it's our memories, it's our essence as individuals. And this can only be achieved if we tackle our problems early. And our technology provides a precise and early detection of cognitive declines that enable timely intervention. So we're really looking forward to being more in Singapore with you. Thank you very much.
Well, there we have it.
There you've heard from all of them. So these 15-minute elevator pitches can sometimes make or break the opportunity.
15 seconds.
15-second elevator pitches can make or break. This segment should be sponsored by Schindler as well, I think. 15, I know, that's a problem. Okay, great. So finalists, thank you very much. You all remain on stage for the moment. You provide us very remarkable solutions. I think it's been a very inspiring morning as well. But before we reveal the winners for today, let's also hear from our judges now. I had the privilege to be in that hot room with them eating and deliberating and multitasking as judges do very well. So let's hear from all of you, and with no spoilers, because everyone's a winner and everyone's going to get super connected following CHISEL. Could we hear from your thoughts about each of these solutions?
Yes, perhaps we can come to Chi Seong first. And what were the judges' thoughts on capture proof? Maybe you could share that with us.
Right, no spoiler. Huh?
No spoilers.
Yeah. I think there's general favoritism. We see this favorably, and we also feel that actually, given the importance of falls in an aging population, and there is actually a very strong business case here. Then we also are mindful that there are many different modalities out there. So Capture Proof is also operating in a very competitive environment, and then there's the value proposition is the one that we need to look at as well.
Right.
Yeah, but overall, I thought it's a great product personally. Thank you.
Great. Thank you. Colin, what did the judges think about I Regained?
Yeah, so Vinit, we were all very impressed with your energy and enthusiasm, as evidenced by your elevator pitch just now. We found your solution really good for looking at a variety of hand-related conditions. The observation we did make, though, was that it appeared to be more center-based as opposed to community-based. So as you go forward in your journey, think about how you could make it more portable. Thanks.
Can I say something? That's our next 12 to 24-month window to add the second edition of it. The current one, you could put it in the recreation club, so to speak, but the next step is to have something that patients can actually do.
Great.
All right, thank you.
So it's a great chance for a little extra 15 seconds. Well done. Yes. Well done. Yeah. The great news is the judges have already decided, but the audience hasn't. The audience hasn't. Okay. Let's come next to Xu Ying. Maybe you can tell us what you thought about Lenexa Medical's solution. Thank you.
Sure, happy to. And great to see you again, Ajit. I was actually very blessed and privileged to be the one to give the feedback on this one, because I must say, the experience listening to you guys speak on the stage sort of lifted my opinion of the solution from what we read on paper. So good job this morning. Maybe 3 points from me. I think first, the use of bed sensors and application of AI on that. I thought amazing application and a lot of potential for future. Second, what I really liked is that what you're measuring is outcomes, right? Whether the patient is having pressure points at the right place, and it allows us to reduce the manpower load and also improve patient outcomes. So where you said there were 0 pressure injuries from all your paying customers, I think that was amazing. And after you guys spoke, I actually started making some calls to nursing home CEOs and told them about the opportunity. So happy to make the link-ups for you guys after this. And then maybe the third point is actually the future for you is interesting. I think what you're looking at using the same bed sensors and AI to look at vital signs monitoring, sleep monitoring, etc. I thought those were very, very nice applications. And we very much look forward to seeing what's coming out from Lenexa in the next bound. Thanks very much.
Fantastic.
I love the bias to action of our judges. Xu Ying already making phone calls, right?
Indeed. I think that was happening in that room. All the judges were saying, how can we connect them all to more players in healthcare? Fantastic. So let's hear next about OcuTrack. And Fouquet, your opinion, please.
Yes, I must thank Mark and his team for a very good presentation. I think it came across very strongly as innovation of high potential to contribute to healthcare in terms of early intervention and also cost effectiveness of ensuring good health. The judges felt that there needs to be more collection of clinical data. They'll support the innovation for adoption. And we understand that you are also a company in NHG. So we hope that NHG will support you to collect the data. And over at Temasek's side, we will see what we can also to connect up.
There we go.
Yeah.
Lovely.
Even more connections.
Yes.
Fantastic.
Hard-working
Thank you.
panel here. Thank you. Okay, Edwin, perhaps we can come to you next to tell us what the team thought about Rosesso Technologies and their solution.
Hi, Jane. Hey, thanks for the presentation and the explanation earlier. The judges actually, by and large, are quite aligned and felt that this product is lightweight, portable, quite likely that it can be deployed in the community, especially at home, with the help of the caregivers. And also, could be extended to nursing homes and senior care center. Noted that you already have the business model of B2B and looking to B2B to C. Perhaps one consideration that you may want to take note of is actually the hygiene factor, because if it's going to deploy in the community, you have to think about how to clean it accordingly. Otherwise, your AI is actually quite a neat future expansion that really demonstrate high potential.
Thank you, Edwin. Thank you.
Right. And next, could we get Shu Qing to share your thoughts about SG Diagnostics?
Okay. So the judges were really very impressed. As I mentioned just now, with your national and holistic approach towards this solution of reaching the unknown. And in fact, we thought that even though your product is already in existence and it's not new, but the key then is to work on the workflows, on the policies that will enable you to reach the unknowns and the unreached. And if this really succeeds, this we consider a breakthrough project. So very exciting. But we just also, as the judges, also have slight sort of like a caution for the group, for the team, which is the question is, what's next for the company after you've done this? Because the barrier for entry is very low in where you're going. So the question is, what's your business model beyond this product? Okay, so just plus and minuses, but good job.
Great.
Thanks, Yu-Ching.
Yeah, great feedback. Okay, let's thhear what the judges thought about Medictor by Tekel Medical. Perhaps I can come back to Fouquet to share us the judges' views on this.
Again, thank you, Veronica, if I get your name correctly, for the very good presentation. We are very confident that you will continue your commercial success into this region. You've been a very established innovation and capability. We are also aware that perhaps when you come into this part of the world, you would probably need to look at your medical data as well as the cultural differences in this region, so that you can actually fine-tune your innovation and your capability to meet the needs of these places here.
Thanks. We should be charging for all this advice as well. All right, last but not least, let's hear from Chen En and your thoughts about ViewMind.
Yeah. Thanks very much, Matthias, for the very good presentation. In fact, in our discussions, we identified a few strengths of the proposal. Firstly, there is a need from the clinical perspective, because cognitive decline is a challenge as our population ages. And secondly, we need something that is easy to administer and something which is not so much language dependent and can be used in multiple different contexts. And third, we were also encouraged by your statement that you will put 20 or more people. If it works, if we give it to you to bring the people in to really make Singapore the base. So I think that does help. But in the whole scheme of things, I think for it to really make a difference, it is moving it out from the hospital into the community. And I think that is going to be a key transition, because a lot of the trials that you are doing today is within the institutional setting. So I think from the judges, I think this was one of the key challenges that I think we have to see how to the translational element. Because for us to really move the needle, we have to reach as many as possible and to reach them as easily as possible. And that leads me to my final point, which is the business model. Because while we want to get as large a number as possible, but if the price or the cost is high, that is a natural impediment. So if you can work out something that makes sense to all parties, I think this could be something that, regardless of whether it is under CHISEL or in another context, something that would be very interested to explore further. So thank you very much for that proposal. So a few strengths, a few challenges that we would need to address. Thanks.
Thank you, Chen En. And the moral of the story, everyone, is be careful what you say when you're pitching, because, Matthias, 20 people, okay? In Singapore, we hold people to their words. Okay, let's please give all our finalists a lovely big round of applause. Thank you.
Thank you.
I'd love to invite you to return to your seats for now.
Thank you.
Thank you also to our judges. The moment has nearly arrived where we unveil the winners of this year's CHISEL Healthcare InnoMatch 2024.
First is the audience choice,
yes,
isn't
let's
it?
find out.
All right. So
let's see if anything's changed since before lunch.
all right. Can we call the polling results as they stand now? Oh, right.
Wow. Okay, you see, you have
SG Diagnostics.
I do believe a few seconds
ahead.
left for last-minute votes, huh?
Let's slowly scroll down so we can see.
Who should be at the top, everyone? Quickly, phones out, last minute voting.
How much time do we have before we close the votes?
20 seconds.
All right,
Right,
we've
you
got 20
have
seconds to
yeah.
make a difference.
Vote,
20 seconds
vote.
for you to call the team back home and ask them to vote.
If your friends and family are here, quick, vote, vote, vote. Let's see if we change these numbers.
Matthias is going to get 20 extra votes, I think. He's going to call on 20 of his friends now.
This is where the...
19, yes.
Okay, is anything going to change? Maybe we're going to... No, nothing major happening in here. Is time up? 3, 2, 1, bam. Well, there we have it. Yes.
SG Diagnostics, everyone. Can we get SG Diagnostics to come on board?
Congratulations.
Yes, both of you. All right.
Thank you so much.
And Tamsin's got the privilege and pleasure of presenting our prize to the team from SG Diagnostics. Please give them
Unfortunately,
another
there
round.
is not $500,000 in here.
Yes.
Otherwise, I would be... No. Congratulations.
All right.
Yes, bring your team. Let's give them a round of
this is the rest of
applause.
the family, right? Come to the center. I'll come to the
There
side.
we go.
All right.
Let me hide my paper behind him.
Congratulations. Okay.
Thank you.
Congratulations.
Well done.
Congratulations. Okay,
In fact, thank you to the
Yes.
audience.
All right. Stay tuned. All right.
Okay. Great job. Okay, so next up, the suspense is mounting. We've had a taster. We've had a taste of success now. We want more, huh? We are about to announce the 3 winners of CHISEL Healthcare InnoMatch 2024 and also, it's like the Oscars. Also, importantly, the healthcare clusters they're going to be partnered with, because it's that test bedding that really does make the difference.
That's right. That's where the magic of CHISEL happens, when the test beds happen in the clusters, and we even get all the other clusters to observe and take part in the test bed evaluation as well. So that's how we speed up the spread of innovation across healthcare. All right, so it's time to present our first solution provider who's going to be paired with one of our clusters. And let's first welcome Shu Qing from NHG to join us at the center of the stage here. All right. And we're going to hand you this huge banner.
Make
right?
it work even harder.
So it's got just the NHG logo, but a blank space on the other side. And we wonder which one of those people are going to come up to fill up that blank space. So, here we go.
Okay.
Fantastic. So, the company that will be paired with NHG is SG Diagnostics.
Well done. Congratulations.
Congratulations. You can take that with you. Yeah. Great.
Well done. Okay, are we ready for the next prize?
Yes.
Next, perhaps I could invite Chi Seong from National University Health System to join us on stage and hold on to the ginormous banner whilst we wait to find out who will be paired with this healthcare cluster. Let's have a look. Okay. I feel like I need a little drum roll. The winner of this category is Capture Proof. Congratulations.
Right. Congrats, Megan.
Thank you, Megan. Megan, it was worth the flight. And the jet lag.
That's your ticket back home there as well. All right. Okay, and it's time to reveal the last winner, But like I said, everyone here is a winner because we're going to get real connected after this competition as well. The last winner who will be paired with Sing Health. So let's invite Chen En on stage. And here's your banner. Okay. This is it. The company that will be paired with Sing Health is ViewMind.
Congratulations.
Hello. Matthias, we did that for you. That's great. Congratulations, Matthias. We will insert you via Photoshop into this picture. Congratulations to Matthias. Congratulations, Chen En. Thank you. All right.
Whew. Well, there we go. Let's please all extend a heartfelt congratulations to all three winners. Your hard work, your dedication has truly paid off, and we're honoured to have you as part of the CHI community. So let's please give one final round of applause to our winners here. Thank you.
And to all the other companies who made it this far, we'd like to express all our sincere thanks and congratulations really for your dedication and contribution as well. From the judges to the deliberation, I know that your journey doesn't really end here at all. In fact, it could be a new beginning for many of you as well. So we're confident that you're going to continue to make a positive impact on healthcare, especially in Singapore.
Yeah, so please don't give up, because the solutions we've seen today, all of them, are too exciting, too impactful to leave by the side. So we wish you the best of luck and encourage you. Keep going, yeah.
Great. All right. Okay, so it's also time to give many, many thank yous to the people, the wonderful people who have made CHISEL and InnoMatch possible.
Yeah, so first and foremost, we would like to express our sincere appreciation to Temasek Foundation for their generous support. It's absolutely fair to say yes, thank you.
Thank
you, Phuket and team.
Thank you very, very much for all your
Without their contributions, we wouldn't be here, so thank
Not at
you
all.
indeed.
Yes. Thank you also to everyone who has been with us every step of the way. There's been an army of reviewers, coaches, many of them are in the audience, who've actually coached each of our 8 finalists right through to the finals. And we really couldn't have done it without the support of all our healthcare cluster partners as well, NHG, NUHS, and of course Sing Health. And also their community partners, very important this time, NTUC Health, One Care Medical Group, St. Luke's Elder Care, and Touch Community Services.
Thank you so much. And also, let's not forget about our co-supporting partners, the Agency for Integrated Care, the Agency for Logistics and Procurement Services, National Healthcare Innovation, and Synapse. Thank you so much.
And lots of logos coming up next to our collaborating partners and agencies for making this possible. It's taken an army and a huge village to make this reach our global audience.
Yes, and I think lastly, let's thank our fellow exhibitors here today, the speakers, the participants, and our online and physically present audiences. Thank you for creating what we've experienced today and making it truly a memorable occasion.
Right. Well, a reminder that this is Singapore, because before we wrap up any event, we need to get some feedback. Otherwise, this event never happened. So we're going to give you a QR code again. Could you just scan that QR code and tell us how you felt about InnoMatch today? And your input's going to help us make InnoMatch even better next year.
Yes, thank you. Little practical note now. Any of you who have signed up for the Collab Novena tour, some of you in the audience are thinking, yeah, that's me. Don't miss it. Don't be late. We'd like you to go to level 4, Lobby C, and gather at the signage near the Puck Provisions Cafe, okay? Please be there by 1:40 p.m. because the tour will leave promptly at 1:45. You don't want to miss out, okay? So that's level 4, Lobby C.
Well, with that, that's the end of today's finals. Can I get you all to give a round of applause to my lovely co-host, Tamsin?
Thank you.
Once again. And thank you all for being part of CHISEL Healthcare InnoMatch. We'll see you next year. All right, goodbye.
Thank you.
Bye.